Since COVID-19 started, there have been concerns about spread to vulnerable populations, including pregnant women.
We talked with a doctor about risks, the vaccine, breastfeeding, and more.
We are talking about pregnancy and the pandemic with Heidi Purcell, a doctor from obstetrics and gynecology of the Hawaii Health Systems Corporation, Kauai Region Clinic at Waimea. Thank you so much for joining us on Living 808.
Thanks for having me.
Well, let's talk about these. As expectant moms, there are a lot of concerns that come to mind, but talk about some of the special issues maybe that have come about because of the pandemic.
Right. Well, we're really isolated from our families right now. And so a lot of people are worried that they'll be delivering alone or they won't have their support that traditionally women might have had from their mothers or their aunties and siblings. They're worried about what is the virus going to potentially do to them if they get sick while they're pregnant. And they're worried about financial constraints. A lot of people have lost their jobs or are out of work and are wondering if it's a good time to even get pregnant.
What are the risks of COVID-19 during pregnancy?
Pregnant women don't do as well as their non-pregnant friends during COVID infections. Unfortunately, we see a higher risk of admission to the ICU. We see an increased risk of mechanical ventilation, and we also see an increased risk of death when you're pregnant with COVID infections. So it's certainly scary.
We hear a lot about the vaccines. Can someone who's pregnant safely receive a vaccine?
Absolutely. We've actually been vaccinating pregnant women since the vaccine was rolled out in December. And we have some new safety data from women in January and February who were vaccinated. And the good news is we don't see any safety concerns at this point.
Tell me about your experience. You have administered the vaccine to some of your pregnant patients?
Yeah, absolutely. We've vaccinated several pregnant patients, and I've been vaccinating pregnant women in my own practice since December, and we've seen really great outcomes. Pregnant women tolerate it with the same number of side effects as the general population, which is to say it's tolerated really well.
Looking ahead for new moms, if they're breastfeeding or if someone's looking to try and get pregnant, are they also safe with the vaccine?
Yeah, we have limited data on lactation or breastfeeding after you've received the vaccine, but there is no theoretical reason why it would be any different than pregnancy. And what we know is that when you vaccinate a pregnant woman, the antibody that she creates in response to the vaccine actually pass into her breast milk and can protect her infant after the baby's born, which is key because babies can't get vaccinated right now. So we're actually able to passively vaccinate your infant by vaccinating the pregnant woman.
I also want to know about prenatal care and what Hawaii Health Systems Corporation is doing to help women through prenatal care.
Well, we've got a really great team here at KVMH. We've been involved island-wide in the vaccination effort and still currently every week have vaccination clinics that are happening. So that's been an incredible outreach that the hospital's been able to participate in. And the hospital's ready. We have surge protections in place and plans. We have appropriate PPE, we're stocked, and we're prepared.
Dr. Purcell, thank you so much for joining us on Living 808. And I'm sure if anyone has questions about this, you suggest they talk to their doctor.
Absolutely. Thanks for having me on the show.
Thanks to them for joining us. It's a conversation, a lot of different conversations we've been having again since COVID came into this. And so definitely want to talk with your doctor.
Good stuff, good info, especially that last one about taking the vaccine if you're pregnant. That's, you know, there's still so many questions out there. It's great to be able to talk to somebody professional like that.